up with the meridian lines and these organ flows?
Yeah.
Points.
The story is it's that the ancient Taoists in meditation began to see these flows and not experimented, but they started to explore it. And then eventually, as they moved out of their more esoteric practices of not being as connected to the outside world, then they started using this for medicine. They started seeing the applicability of it. Yeah.
And did they originally use needles to tap into the chi, or?
The Taoists would use meditation to tap into the chi, and then they started developing other techniques. Yeah. And there used to be many, 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 many different types of needles. Different shapes, different sizes, different ways of pointing. Right now, we only use 3 predominantly.
And what's your take on uh, other modalities that kind of parallel the principles of TCM? Like I've heard there's aromatherapy, sort of acupuncture and flower essence acupuncture, where it's non-needles and they're tapping into those points.
Yeah. I don't have personal experience with aromatherapy in it, but I've heard wonderful things, and I know many acupuncturists who really enjoy it. Right? There are energetic properties to everything. Everything we eat, everything we touch, everything we interact with, whether it's alive or not alive. And flower essences, for instance, has a very strong vibration. So using it, why not? Is my point of view. I had a classmate when I was in school a long time ago who she didn't really like being needled, but she loved acupuncture. So she trained with a man named Dr. Bear. I think it is B-E-A-R, like a bear. And he uses contact needling. And so what he has is they're 2 like really big needles, like big, not for actually inserting, but they're like big. And one side is rounded and one side is pointy. And one is made out of gold and one is made out of silver. Gold in Chinese medicine is used for tonifying. Silver in Chinese medicine is used for sedating, removing excess. And so I had a treatment from her once, and she just put these needles on the points, and huge responses that I got. It was really amazing. Or sometimes what I'll do is if someone is really sensitive, I'll just hold the needle where it's barely sticking through my hand, tip of it, and just hold it up to a point and get that response. Patients will feel that.